Welcome. Thank you for joining the 2023 Charles C. Shepard Science Awards ceremony. Today's ceremony gives us a chance to celebrate the agency's high-impact science and the outstanding scientists who are leading this work. Next slide. We have an exciting agenda which includes remarks from our CDC director, a fireside chat with the director and our keynote speaker, presentation of awards, and closing remarks from CDC's Chief Medical Officer and Deputy Director for Programs and Science. Please note the agenda and program booklet are available on the Charles C. Shepard intranet page. Now, I'm honored to pass the microphone to our CDC Director, Dr. Mandy Cohen, for a few words.
Great, thank you, Paul. Hi, everyone. Great to be with you. I am thrilled. This has been what I've been looking forward to for a number of weeks now, mostly because of the incredible scientific achievement that we are going to recognize, but also I have to fangirl a little bit about the upcoming fireside chat with Adam Grant. So I'm looking forward to that. But first, just want to recognize the incredible scientific achievement that we are going to be recognizing today. It is incredible the amount of hard questions, the labor that has gone into asking these questions and finding answers for the American people and frankly for the world to help people be healthier, to solve really hard problems. I think we are all so lucky to work at an institution and at this agency where we get to put science into action and be able to do that work. And we're going to be recognizing quite a number of people today for that incredible work that they've been doing. I want to thank the Office of Science for organizing today, and particularly to the committees who took on the daunting task of having to actually award some of the great work. There is so much. It's really hard to choose a winner for all of this. So I really want to thank everyone who did the hard work of getting to our prestigious award winners. And importantly, thank you to all of the scientists at CDC. Whether or not you are the winner today, it is an honor to be nominated, just like the Academy Awards, truly, right? It is an honor for us all to be at this agency, to do the kind of work we do today. And this is just icing on the cake to be able to recognize you all for that work. And I know it means to me, and I'm sure many of you, that, this is more than just the numbers or the papers we've published, but it is really how CDC can focus on science in service of public health impact. And it is that we are changing people's lives, that we are creating healthier individuals, families, communities, states, tribal nations, country, and obviously the world. So I'm really thrilled to be here today. I want to turn it quickly back over to Paul to introduce Dr. Adam Grant. As I said, we couldn't be more excited to have him here. He is an incredible scientist on how organizations work, how we can all be better leaders in the work that we are doing. So I'm thrilled for you to hear from him. And so, Paul, I'll turn it back over to you to introduce Dr. Grant.
Thank you, Dr. Cohen. As always, we appreciate your strong support of science and CDC's role in leading science for public health action. Now, next slide, please. Now I'd like to introduce today's keynote speaker, Dr. Adam Grant. Dr. Grant is the Saul P. Steinberg Professor of Management and Professor of Psychology at Wharton School at the University of Pennsylvania. He has been recognized as Wharton's top-rated professor for 7 straight years. As an organizational psychologist, he's a leading expert on how we find motivation, meaning, and live more generous and creative lives. He has been recognized as one of the world's 10 most influential management thinkers and Fortune's 40 under 40. We're thrilled to have him join us today for a fireside chat with Dr. Cohen. And so without any further ado, I'll turn it over to them.
Okay. Dr. Grant, welcome.
Thank you. I only answer to Adam.
Okay, Adam, we are thrilled. I cannot see you yet, but I'm going to wait for folks to pull you up on the screen. All right, there you are. Adam, first, okay, let me fangirl a little bit first. I first got to know about you and your work from armchair expert Dax Shepard, Monica Padman. I love hearing you go on their show. I love having you dissect a lot of really interesting and hard topics, and that has made me a fan for a long time. Just to introduce you to the CDC team a bit and some of the challenges we're facing, we're so thrilled that you could join us. There's so many topics we could talk about. CDC is the agency in the government that is meant to protect the health of this country. And we're here to honor scientists that do that important work that really powers our ability to protect health, to identify disease, to respond quickly. And it's an incredible team. But we've gone through a lot the last number of years. And CDC has had some really hard challenges, as have we all, right, through the pandemic. And we're navigating a lot of change in a good way, right? There are a lot of lessons learned, a lot of attention on public health. And so we're thrilled to get your advice and counsel to us as we turn this new chapter. We've learned a lot of lessons. We are in a different moment. We're outside of an emergency. And we are repositioning ourselves as CDC going forward. And we have a lot of work to do to navigate some hard changes. So I'd love to just open up as we start here. You've thought a lot about organizational change, how that is, change is hard, no matter whether you're coming out of a pandemic or not. I'd just love your reflections as we start here on change. And then I really want to talk about two important topics: prioritization, right? Because when you're changing and we're trying to make impact, we can't do it all. So how should we think about that? And then I want to talk about one of your podcasts that you talked about, why meetings suck and how can we make them suck less. All right. So those are the two things I was hoping we could, and then there's going to be more, but I'd love to hear your thoughts on change management, because we are going through a lot of change, and how folks can think about that individually and collectively. Then we'll talk about prioritization, collaboration, and then why meetings suck and how we can make it better.
Sounds like a plan. Only 9 hours or so worth of ground to cover. Well, first, let me just say I had no idea our CDC director was an armchair. That's a fun discovery.
Nice.
Also, let me just say to all of the scientists with us, I think you've done for the past few years the ultimate definition of a thankless job. I think we've been relying on all of you in such vital ways, and despite this being sort of the most critical time to be a scientist, I know it's also been probably the hardest time in generations. And I just want to say I'm really grateful for that, because I'm sure none of you have gotten the full appreciation and respect that you deserve. So let's see, we want to talk about change. I think change it's probably the hardest thing that organizations do. It threatens people's sense of competence. It threatens your sense of comfort. It makes it harder to predict the future. It's destabilizing in a lot of ways. And I think my favorite research on change starts with the premise that leaders often oversell and say, hey, here are all the things that we need to do differently to be successful in the future, forgetting that people are already pretty content with the status quo in a lot of cases. And I think empirically what we know is when you're going to talk to people about change, it's really helpful to let them know what's going to stay the same. So, our DNA, our values, our vision are going to endure. And here are some routines that we want to try to evolve in order to achieve our goals in a dynamic and complex world. I think that's the kind of message I would love to see people communicate and internalize more often, because the reality is, it's very often not the heart of an organization that needs to change. It's the way people operate on a daily basis. And I guess what scares me the most is that we see so many organizations that cling to best practices, not realizing that those practices have become obsolete. They were built for a world that does not exist anymore. And so I think we need to be constantly looking for better practices. The challenge there is you can't rethink all of your practices at the same time. And so you have to prioritize around, okay, which of these need to be questioned and challenged and evolved, and which can stick for now. So for me, that's at least a beginning. We could talk lots more, but I'll let you decide where you want to take this, Dr. Cohen.
Yeah, that was a great opening, Adam, and please call me Mandy if I'm calling you Adam. So let's talk about prioritization, because I think that is so hard. I think it's always, I will say for me as a leader, I feel like it is almost easy to articulate the priorities, but hard to stop doing things in service of those priorities that you've articulated. I'd love to just hear your thoughts on prioritization.
Well, I think I'm maybe this is a little bit unexpected, but I'm going to go to Jeff Bezos here for a second because look, whether you think he's Superman or Lex Luthor, or whether you love or hate Amazon, I think he's been one of the most effective prioritizers of our time. And I think that, if you look at why Amazon was so successful, it's not that he's inherently smarter than his peers. It's that he's better at prioritizing. So I remember a few years ago, I went to give a talk at Blue Origin, his commercial spaceflight company. And I'm about to get on stage and Jeff walks in and sits down in the front row. And I'm like, I have a lot of questions for you. If we're going to trade roles, I'd like to have you give the talk and I'll do some grilling. But afterward, I wanted to get his sense of how he decides what matters and what doesn't. And I came away from that conversation with a 2x2 framework that tracks pretty closely with the research evidence I've read. And I think about it almost every day, and I don't even have a real job. So probably more relevant to all of you than it is to me. So Jeff's basic analysis is when he's going to make a decision, he asks himself two questions. The first question is, how consequential is it? The second question is, how reversible is it? And what he prioritizes are the highly consequential, irreversible decisions because they really matter. And you can't easily change your mind tomorrow once you've committed. So in Amazon world, that's, you can't wake up tomorrow and say, those billions we poured into the cloud, just kidding. We want them back. Huge investment and sort of a permanent commitment. The other three quadrants, I think, can be delegated. They can be deprioritized. They can be procrastinated on. I think it's the consequential, irreversible ones that we've got to pay attention to.
Great. Well, if I can poke at that a little bit more, particularly because today we are going to be honoring some of our incredible scientists. And you can imagine scientists often tend to be perfectionists. And it is hard for our perfectionists sometimes to and I'll say self-identified, that sometimes can also be a negative. And you've written a ton on this. And as we think about prioritization, sometimes the perfect can be the enemy of the good, as they say. And so I'd love to hear your reflections on that as well.
Yeah, I think the best research on perfectionism was done by Thomas Curran. He's published a couple different meta-analyses now, which show that perfectionists get better grades in school, but they do not perform any better in the workplace. And that actually is a follow-up by Donna Harari and her colleagues, another meta-analysis. So what's going on here? Why is perfectionism an asset when we're studying, but not when we're working? Well, it turns out that perfectionists are very good at figuring out exactly what's going to be on the test and then cramming everything they need to know into their heads in order to ace it. The problem is, in the real world, nobody tells you what's on the test, and sometimes no one has even thought through what the questions are going to be. And perfectionists really struggle in that predictable environment to do a couple of things. I think the first challenge they run into is seeing the forest in the trees. They're often worried about getting the small details right, and they miss the big picture. The second challenge is they tend to focus on the things they know they can ace and master. And that means they tend to stay in their narrow comfort zones. They play to their strengths, and they don't necessarily challenge or stretch themselves. They don't take intelligent risks. And that actually is limiting. I've come to believe that if perfectionism was a medicine, it would come with a warning label that would say, warning, may cause stunted growth. And then the last problem, Andy, is burnout. Perfectionists ruminate a lot. They beat themselves up constantly for tiny flaws. And that can be exhausting over time. And I think they need to be reminded regularly. And I know this as a perfectionist who's still in recovery, that the point of reviewing your mistakes is not to shame your past self. It's to educate your future self. So the question is not, what did you screw up yesterday? It's, what did that teach you that will make you better tomorrow? And I think internalizing that question is easier said than done.
Yeah, that's great. I want the team to also hear from you a bit on having hard conversations or giving advice. I know you've written a lot about advice versus feedback, and advice being very rich if you ask for it in the right way. Can you talk a bit about, what I see we have just some of the most lovely and caring, kind people at CDC, and often I think we worry that we don't want to lose our kindness in giving that feedback or advice in service of us all getting better? And like, how do you think about balancing all of that together?
I think the mistake that too many people make is they confuse politeness and kindness. And for me, politeness is about saying what's going to make someone feel good today. Kindness is telling them what's going to help them do better tomorrow. And I think if you have to choose, we want to be kind, not polite. I think, as Brene Brown likes to put it, clear is kind. If you don't tell people, if you see something that someone could do better and you don't tell them, you are doing them a disservice, right? You're actually preventing them from developing and working on whatever their area of weakness is. So how do you do that effectively? There's some interesting work by Greg Walton and colleagues, which shows that if you say about 19 words before you give someone a piece of constructive criticism, they become significantly more receptive to it. The 19 words are roughly, I'm giving you these comments because I have very high expectations and I'm confident you can reach them. Completely changes the meaning of that interaction. I'm not attacking you. I'm here to coach you and try to help you. Mandy, I taught this a few years ago at Wharton for the first time. We did a session on feedback. I covered this research, and then a few weeks later, I give out mid-course evaluations. And 3 different students wrote at the top, I'm giving you these comments because I have very high expectations and I'm confident you can read. I'm like, no, you don't have to use the words verbatim. The point is to communicate that you believe in the other person's potential and you care about their success. If you convey that, it is surprisingly easy to hear a hard truth from somebody who has your best interests at heart. And I think that message is really critical. I think when people get defensive, when they shut down, it's a sign that you haven't invested enough in the relationship to make your intentions clear and earn the right to give them that tough love.
Well, that makes me think, though, that in order to do that, you've built some rapport, some trust, that relationship. Can you talk a bit more about how we can do that more within our workplace? Because I think there is often folks like to keep professional boundaries, and like, how do you think about that in a workplace environment?
So most people think that I can be vulnerable once we've come to trust each other. And empirically, that's backward. Vulnerability is not a consequence of trust. It's a precursor to trust. We come to trust each other when we share things that we're not 100% secure about. And then kind of look in the mirror and think, why did I say that? I must trust this person. Otherwise, that was a really dumb thing to reveal. So some of the research on this, I think, is mildly entertaining. There's evidence that if you pair people up, for example, and have them tell each other an embarrassing story, that they become significantly more creative in a pair brainstorming session then, both in the volume of ideas and also the novelty that they generate. And I think the good thing about that exercise is you get to choose the embarrassing story. So you choose something that's mildly uncomfortable as opposed to mortifying or humiliating. And after doing that, you say, all right, this is a person that I can rely on to not take advantage of me or, not embarrass me now that I've opened up. Maybe another example of what that might look like. Konstantinos Koudaferis and I published a paper last year where we randomly assigned leaders and managers to try to make it safe for other people to speak up. And what most leaders and managers did by instinct was to say, hey, if you see something, say something. If you have a suggestion or a criticism, let me know. In many cases, that was not enough because their employees had no idea if they really meant it. And many of them were like, nope, you cannot handle the truth. I'm afraid you're going to bite my head off, or that you're just going to be too busy and you're going to dismiss my input. What we found worked better than asking for criticism was actually criticizing yourself out loud. To talk about the things that you're bad at, that you're trying to improve at, to share some of the previous feedback and criticism you've collected, and then explain what you were trying to do about that. So I worked on a project at the Gates Foundation a couple of years ago where I had tested a version of this, and to have some fun with it, we said, let's do Jimmy Kimmel's mean tweets only at work. And Mandy, to her credit, Melinda Gates volunteered to go first. And she said, I want to be in the hot seat to kick this off. So her team gathered 20 years of criticism on her, handed her note cards one at a time, and she just read them out loud. And the first one said, Melinda is like Mary effing Poppins, practically perfect in every way. She burst out laughing. She said, I am so not perfect. And then she started listing her imperfections. So I turned that into a simple RCT. A third of employees got to see that video of her engaging with the tough criticism. A third got to hear her talk about the psychological safety that she was trying to build in the culture, but not personally engage with the feedback. And then a third were a peer control group. And only that first group ended up giving more constructive feedback and suggestions to the senior leadership team in the following few months that we tracked. And I think there's a really powerful lesson here, and it's one that I've tried to apply in my own classroom, which is when I get my students mid-course reviews, I actually send them out verbatim to the entire class. Then I do a content analysis and I read out loud the toughest ones. And afterward, the floodgates open. I hear ideas and suggestions and also concerns that they hadn't raised before. One of which was that I reminded them of a Muppet. That was delightful. But another was that early on, I was so nervous, I was causing them to physically shake in their seats. And when I point those things out, I think what's happening is they're realizing that I take my work seriously, but I don't take myself too seriously. And that, I actually am willing to hear whatever it is that's on their minds. And I've worked with a lot of leaders and a fair number of scientists too, who are afraid to do this. And whenever I hear that, my first thought is, listen, the people who work with you closely, guess what? They already know what you're bad at. You can't hide it. So you might as well get credit for having the self-awareness to see it and the humility and integrity to admit it out loud.
I love that. And I think that we do so much partnering at the CDC and with each other, right? We rely on each other in order to serve the country well. And so being able to have those open and honest conversations, to be self-critical and to facilitate sort of that ability to talk to each other. I think that is going to be certainly my takeaway here, to be kind. We don't, it's not about just being polite. I think that's terrific. And I think we can apply, all of us can apply that. I'm going to use though your words verbatim though, that your class said back to you about, I'm giving you this feedback because I care deeply about you. And I know that you can meet these high expectations. I love that. I love it. Okay. I know everyone is very interested. We have a lot of meetings here at CDC. So before we run out of time, I have a couple other things, but I want to go to this, why meetings suck and how do we improve it? Because I think everyone would look at their calendar and say, wow, that meeting could have been an email, right? A lot of times. So how could we think about maximizing our time? And I will say, we're also working here at the CDC, post-pandemic, different kinds of hybrid working environment. Number of us are continue to be remote. We're working on bringing everyone in on Tuesdays and Wednesdays so we can really maximize in-person time together, but it does mean we have to use our time differently. So I'd love your advice for us about how to maximize in-person time and how do we make meetings not suck?
Well, I don't know if there are any easy answers to that, but for me, it starts with trying to figure out why are we meeting in the first place? So as far as I know from almost half a century of research on meetings, there are only 4 reasons to get together. 1 is to decide, 2 is to do, 3 is to bond, and 4 is to learn. If you are not gathering for one of those 4 reasons, guess what? You do not need to gather. So I would start by saying, let's be clear on the purpose. Is this a bonding meeting? Is it a learning meeting? Is it a decision-making meeting? Or is it a meeting to try to create or get something done? And I think if you do that, we actually solve a lot of the problems in meetings. Maybe as a concrete example of what that might look like in a decision-making or a creativity meeting or any kind of doing meeting, what most of us do is we say, all right, we know 2 heads are better than 1 and 5 are better than 2. So let's get a group together to brainstorm. And I'm delighted to see that happen, Mandy, except for just this one little wrinkle, it doesn't work. If you track all the randomized controlled experiments and also some of the longitudinal studies that have been done in workplaces, the average finding is that if you had let those people work alone instead of together, you would have gotten more ideas and also better ideas. So I think brainstorming meetings capture a lot of what goes wrong in the meeting itself, even if we're clear on the purpose. We see production blocking. We can't all talk at once. Ego threat. I don't want to look stupid. Conformity pressure. I want to jump on the bandwagon of what's popular. And then all of a sudden you get groupthink instead of diversity of thoughts.
Mm.
So the antidote to that is called brain writing, where you give people the problem or the prompt in advance. You let them generate their own ideas independently. Ideally, you collect those anonymously, and then you have everyone do separate ratings. And what we know is that individuals are more creative than groups. They have more brilliant ideas, but they also have more terrible ideas because we're too close to our own ideas. We fall in love with them too quickly. So once you have all the ideas on the table and you have separate independent judgment of them, that's when you want the wisdom of crowds and the group to figure out how to evaluate and refine. That's an example of something for me that does not need to be a meeting, right? We should do our creative thinking before the meeting. We should get all the ideas on the table together. And then we can start to figure out how do we take advantage of the strengths of the group. And I should say, this is my favorite thing about being hybrid or virtual, the chat window. I cannot tell you how many meetings I've run since spring 2020, where I've said, let's take the first 10 minutes for people to type their thoughts. And then once they're all out there, then we can start figuring out which of these ideas have real potential.
Nice. What a cool tool. Because yes, we are still running tons of hybrid and remote meetings. So that's a great idea about thinking about at the beginning of the meeting, if it's a creative or a brainstorming, how do we use the chat feature to sort of, I like that, instead of brainstorming, brain writing. I think that's really great. There was a question in the chat here more about remote work and hybrid work. Look, everyone is trying to figure out this new world. Any advice for you about how to keep connection up in a remote world?
We did a work-life episode last year on this, on the do's and don'ts of returning to the office. And I think the state of the science hasn't evolved a ton on the connection front. So let me highlight maybe 3 quick things that I've found pretty useful. The first one is connection is much more likely to happen one-on-one than it is at the group level. Mm-hmm. So pairing up, doing breakouts at the dyad level, it's a lot easier to be vulnerable in front of one person than it is a whole group. I think we're trying to do too many team building exercises, too many icebreakers, too many virtual trust falls. What we really need are person-to-person conversations. So that would be principle 1. I think principle 2 is at the team level, what people need most is actually not interpersonal bonds. It's not social cohesion. It's mission cohesion. People need clarity about the broader collective goals and then about their individual contribution to those goals. There are a couple of meta-analyses that speak pretty well to this, but the basic finding is if I know what we're trying to accomplish and I feel I have a unique contribution to make to that collective objective, it doesn't matter that much how well I know the person on my team. And an extreme example of this would be a SWAT team where you can literally show up to collaborate with a bunch of strangers and you know exactly what your objective is. Everybody knows what everyone else's responsibility is. And they can often function like a team that's been together for many years. So that would be principle 2, goal clarity, role clarity. And then the last thing I would say for connection is I think we need to tell culture stories. I think what we've really lost with less in-person time is, a lot of times you're not in the room or in the Zoom when critical moments are happening. And we know that part of building and reinforcing culture is telling stories. And my favorite culture stories are the ones that highlight what's something that would happen at the CDC that would never happen in any other workplace. Mm-hmm. And there's a positive and a negative version of that story. What we want to do is catch the moments that really highlight what makes the CDC different. And then let people know, this is what makes us special. And then also capture the things that wouldn't happen elsewhere that you don't want to happen anymore and tell the stories of what went wrong. And as people get those concrete examples of what it looks like to uphold the core values of the culture, what it looks like to violate those core values, it's a lot easier to keep culture alive and also to keep evolving it. I
love you pushing us to make sure we're not just highlighting successes, but sometimes where we fall down. I like falling instead of failing, right? Because we're all falling down, and it's how you get up. And so this is a shameless plug on myself to the team. I sent out, for example, one of our check-in emails where I send out and I highlighted some great work one of our teams is doing related to some environmental exposures in East Palestine, Ohio. You might have heard about the train derailment. So we're highlighting, they did some just incredible work and continue to do that work, protecting that community. But I love you challenging us all to also think about where the things that haven't gone right and need to go better, and how do we think about bringing those stories to the forefront in that kind way to say, we have high expectations. The country has high expectations of us, rightly so. We have high expectations of each other. How do we continue to make sure that we're getting better? Okay. I know we're getting close to the end of our time here. So what we've been focused on a lot here at the CDC is about trust in a lot of different ways. And we've been kind of poking at trust in a number of ways, right? You have to have some trust so that you can give feedback and advice. What advice do you have for us at the CDC on how we can continue to build trust both internally here at CDC? Because I think trust starts with us trusting each other, right? So the scientists trusting the people who work in the IT system, who work with communication and lab and contracting, and right, it's a really, we're interdependent here at CDC. And then I'd love your thinking about, as a consumer of what we put out there in the world, what can we do better to make sure that we are building trust with you and with the American people?
Okay, the first one's easier than the second. Let's just be clear. So on the first front, I think, we know shared work is a big driver of people trusting each other. And if you want to break down what trust means, it's typically studied in terms of 3 dimensions. To our character, the benevolence and integrity. So benevolence is having good intentions. Integrity is being able to count on the fact that your word is your bond, and your actions will live up to what you promise. And then there's a basic competence reliability dimension as well. So people collaborating closely together seems to drive trust much more effectively than just people getting to know each other at a personal level. I think what we overlook in a lot of cases is it's not the frequency of interaction that matters, it's the intensity. So if you have a 1-hour meeting every week with somebody, you are going to stay at the surface level. If you have to go much deeper and spend a whole day collaborating with someone, guess what? You're going to really find out quickly whether you can trust them or not. And so I've become a big fan of what Anita Woolley and her colleagues call burstiness when studying collaborative knowledge work, which is the idea that the most creative and productive teams actually collaborate in bursts. They'll go off and do their individual deep work for a couple of days. Then they'll come together and do a blitz where they're taking highly interdependent tasks and they're going back and forth in real time. And then they'll divide and conquer again. And I think that kind of pattern is great for trust building, in part because as it builds productivity and creativity, high performance is one of the easiest ways to establish trust. Once you're effective with a group of people together, you tend to trust them. Externally, Adam Federman's work on wrongness admission is my favorite body of research on this. What he shows is that when scientists admit that they made a mistake or they got something wrong, they actually earn more trust, not less. And part of that comes from the fact that when I hear what you did wrong yesterday and I see you own up to that, I know that if you screw something up tomorrow, you're going to tell me as opposed to trying to hide your mistake. Yeah. So that's a trust signal. Part of that also comes from when people admit that they're wrong, it signals that they care more about getting it right than being right. That they're putting their effectiveness above their ego. And I think that's an important message to send. And so, I mean, Mandy, I don't want to point fingers at any particular agency. I'm stunned that there hasn't been much in the US government to do kind of a postmortem on here's what we got right in COVID. Here's what we screwed up. Here's how we're evolving our practices accordingly. And by the way, none of us have ever lived through a pandemic before. And we made a lot of mistakes, as every country did. Let's try to learn how we can do better next time. I've been waiting for that. And I don't know who it should come from, but it's got to happen. And the longer we wait, the less credible people are going to find it.
Well, you have a lot of thumbs up here. And I will say we are doing that and have done that internally. And I really give credit to the team that they've done some hard looking. That's why I started off with change management. We are we did look at what went well, what didn't, how do we need to refocus as an agency. And it does mean that we had to meet a moment. The world is different in 2023 than it was in 2019, and we have to be different as a result. And so there's a lot of change going on. So I want to assure you that that folks have been, but I think you're right about this, the bigger, frankly, more global look at what we've done well beyond the CDC, but across, frankly, the whole country, and how we can really learn to be better. So we take that. But I love this, and I want to end on this note and then give you the last word, which is, that to be trustworthy does not mean you need to be perfect. And in fact, admitting a mistake and being clear on, like, I was wrong there. I take responsibility for that. And here's how, one, I won't make that mistake again because things are different and I've learned from it. And you can know that I'm going to come back to you if anything is wrong in the future, right? That actually builds more trust. I saw that I led North Carolina through the pandemic, and there were plenty of times where I screwed up there. And I got more positive feedback when I went in front of folks to say, like, I got that wrong. Here's where we are right now. So I really appreciate that, because again, our wonderful scientists, again, we always want to bring our best, and we want to be right. We want to be first. We want to be accurate, but we sometimes get it wrong. And it's okay to say it, own it, and that actually can build trust. So that's awesome. Okay, team, that was so fantastic. Let me, Adam, turn it back over to you. You have hundreds of incredible scientists, folks who are very mission oriented. That is not that mission is always very clear. Here, it is wonderful to wake up every day and work with this team. Anything else you would want folks here to know, wisdom that you have for us?
Well, I love the way that you described the importance of admitting mistakes. And maybe just to build on that, I think sometimes we do a terrible job. And when I say we, I'm a social scientist, and I know you all do more hardcore science. But if I can join the group of scientists here, sometimes we don't show our work enough. Particularly when trying to come up with a public health message or a soundbite. I think we sometimes do a really bad job, and I've been guilty of this a lot. Of taking the nuanced analysis, the many boundary conditions, moderators, questions that are unanswered in our limitations and future direction sections of our papers, and making that clear. I think all the time we spend thinking like a scientist ought to be invested also in communicating like a good scientist. And I think what that means fundamentally is when we explain our findings, we need to highlight the contingencies. When will they hold? Where might they not hold? We want to give the caveats. Here are the limitations of the sample that we had. I think we're all trained to do this in our scientific communication, but it turns out if you qualify, people are no less likely to trust you as a scientist. But they are more likely then to recognize that, hey, this is really complicated. And I guess when I think about what that would look like, maybe as a concrete example, my most hated message since 2020 is vaccines are safe and effective. That is a completely meaningless message because it's a little bit like saying cars are safe and effective. Well, yeah, I mean, they're sort of safe, but how safe? They're not safe for everyone. And sometimes they break down and sometimes they don't get you where you want to go. And you would never make a statement like that. You would give the relative risk level and create some kind of odds ratio to say, here's the relative safety of taking a car versus a bike. And here's the relative efficacy for a given trip. And I think it would have made such a difference if we had trained our public health leaders to say, here's what we know about the relative safety of getting vaccinated versus not on the following outcomes. So let's talk about myocarditis. Let's do this on a bunch of different dimensions. And guess what? Our science is still evolving. And so we're going to update you as soon as we have better evidence. I think that kind of communication is something we all need to practice. It goes against, I think, our instincts when we're trying to give people clear guidance, but it's exactly what we're trained to do as scientists. And I honestly think we should talk more like we write our journal articles, and we would both be more candid and also more trusted.
I love that. That's a great place to end here, particularly because you're getting a lot of hearts and thumbs up here on how and when we were really trying to. I think this is a hard place as we try to communicate good science, and particularly in our world of social media and not even 30-second sound bites, like 10 seconds to communicate a message. How do you do that and maintain trust and the answer is like we have to find lots of new ways. And you, Adam, are an incredible communicator. So we have a lot to learn from how we can both be clear on the message and help people understand the nuances of what that is. So I think that's absolutely fantastic. I can't tell you how many hearts you've received here. So thank you again for your time. We are so lucky that to have you. Like I said, total fangirling, and we look forward to. Oh wait, I have your book sitting here. Hold on. All right, everyone, go out, get Hidden Potential, because everyone here at CDC, there's so much potential here. And I think as we work through some of these lessons learned, we're unlocking that potential here at the agency, individuals as well. So I'm pretty proud of this team.
Can I throw out one other thought?
Yeah, please.
Before we wrap. I'm just thinking out loud here, but I wonder if there ought to be a CDC advisory board or council on some of the sort of organizational and psychological challenges that you face as an agency. I think, it's amazing to me that for all the science that went into, sort of fighting COVID, there was almost no adoption of the social science of effective communication. And I had frantic texts from a few people on the White House COVID task force saying, we've got to roll this message out in an hour. What does the evidence tell us? There's literally a group of 30 people who have an email thread going, trying to synthesize all this. Why is this not in the hands of people who are doing the work? I think there would be great interest in doing that. And there are a lot of people who would be happy to serve if they could be helpful. So if that's of interest, let me know. And Mandy, let me just close by saying thank you for your openness and humility as a leader. This is exactly what I think we need more of our government leaders to be modeling. And what you've just expressed today is precisely what I'm trying to nudge more leaders to do. So thank you for that.
Well, we'll be in touch, Adam, because I think particularly on this last point about the science behind communication and behavior change, the implementation science, we're going to be recognizing a lot of folks today for scientific achievement here. But I didn't even like how you said, oh, hard science, soft science. No. We respect all the science, right? Because we need all parts of it, right? To make sure we're being effective. The best vaccines in the world that sit on the shelf don't save lives, right? And so we definitely I hear you. So I'm going to be in touch about that last point, and I really appreciate it. Team, give Adam one more round of applause. I know you can't hear them, but they're virtual applause here. So thank you so much. We really, really appreciate you taken the time with us. Really special.
Thank you. It was an honor to share ideas with you. Thank you all again for the work that you do. It's so vital.
Thanks, Adam. All right, Dr. Muntner, I'm turning it back over to you to get to now our awards. That was awesome, guys. I was so excited.
Yeah, that was an amazing conversation, discussion. I've listened to Adam for years. I have read his books, and I was just thrilled that we're able to have him here today. And especially,
I want to say, Paul, that was really the Office of Science was and the team that they were the ones that said, can we get Adam Grant? And I said, do you think we can get him? And I was so thrilled that he took the time to do it. So that was great. So thank you, Paul. Thank you to the whole OS team. And now let's get on with some awards.
And it's really the OS team. And in the interest of time, I'm just going to go to the next slide and really thank those people who, not only got Adam here. Next slide, please. But thank you. I wanted to give special thanks to the many people who orchestrated the awards process and those who worked to put on the event production. There's so many people involved in the planning process. And I want to express my special gratitude to Dr. Joanne Kono for her leadership as the program executive, really working to get not only Dr. Grant here today, but so many other aspects of the program. Additionally, many other people went into the work that you're seeing today. Tony Richardson, Tandra Bailey, and then Patrick Idarabigby. And so please just give a round of applause to them because they're the ones who did all the work to put on this special event. So thank you. Next slide, please. As part of the agency's commitment to health equity science, the Office of Science launched the Health Equity Science Manuscript Development Program. We thank the Office of Health Equity for their continued collaboration on health equity science and this manuscript development program. Through this program, we aim to expand the capacity of CDC scientists to conceptualize, develop, and disseminate high-quality scientific work that supports the advancement of health equity. I'm delighted to report that the second cohort, the group that you see pictured with smiling faces on the slide, is wrapping up their work. Each of our fellows has produced a scientific manuscript centered on health equity topics ranging from structural drivers of mental health care inequities, race and ethnicity reporting in occupational respiratory health, and upstream mechanisms connecting multiple job holding to adverse mental health outcomes among racial and ethnic minority pregnant workers. Please join me in giving a round of applause and congratulating our 2023 cohort. Next slide, please. In addition, our call for applications for the 2024 cohort is now open. As we launch our third cohort, we're excited to share new additions to the program, which includes new workshops. There's a public health intervention workshop, which is going beyond investigation or analysis of health disparities to designing implementation and evaluation of interventions that address health disparities. Additionally, there's capacity building, and this one I especially like. It's a train the trainers workshop, equipping participants to serve as trainers in health equity science writing within their CEOs and with partners. The program provides an excellent opportunity for professional growth and to contribute to CDC's efforts to advance health equity science. We're encouraging all CIOs to submit nominations. As you see here on the slide, the deadline for applications is November 13th. And now, Dr. Maria Mirabelli, the 2023 Charles C. Shepard Chair, will take us through this year's awards program. So Maria, please.
Thank you, Dr. Muntner, for the introduction. It's my pleasure to welcome everyone to the 2023 CDC ATSDR Charles C. Shepard Awards. Next slide, please. And then next slide, please. As the chairperson, along with co-chair Elise Beltrami, we'd like to thank all the members of the Shepard Awards full committee. Committee members are listed here and include the chairs of the category subcommittees. These committee chairs oversaw the committee's review of nominated papers and the selection of finalist papers to ensure the processes were implemented with integrity and transparency. Next slide, please. We'd also like to recognize the Shepard Awards Program Committee. The committee includes many employees who work diligently behind the scenes to make sure the awards process proceeds smoothly and to produce our program today. Next slide, please. As we begin the award ceremony, we want to share some additional information about publications by CDC authors. In 2022, CDC authors contributed to 3,125 scientific publications that were published in 792 journals. This year's ceremony recognizes 83 papers nominated across 5 scientific categories. These categories are assessment, data methods and study design, health equity science, laboratory science, and prevention and control. We also recognize 5 nominees for the Lifetime Scientific Achievement Award. For more information about all the nominated publications and scientists, please see the online program available on the Shepard Awards intranet site. Next slide, please. I'd now like to introduce Dr. Umed Ajani, Chair of the Assessment Subcommittee.
Thank you, Dr. Mirabelli. Good afternoon, everyone. The assessment category recognizes the publications across CDC and ATSDR that characterizes health, disease, condition, or behavior and their determinants in communities and populations. Next slide. I would like to acknowledge the members of 2023 Charles C. Shepard Assessment Committee and thank them for their expertise and for serving on this subcommittee. There were 28 outstanding nominated papers in assessment categories, as shown in the following 6 slides, which made choosing the winner very difficult. Next slide. And the winner of the 2023 Charles C. Shepard Science Award for Excellence in the assessment category is, next slide, myocarditis cases reported after mRNA-based COVID-19 vaccination in the US from December 2020 to August 2021. Named by JAMA as its #1 most talked about article of 2022, this manuscript describes and estimates the risk of myocarditis due to mRNA COVID-19 vaccine by sex and age. With this information, CDC was able to demonstrate that the benefits of vaccinations substantially outweighed the risk from myocarditis, to provide strong communication about the benefits of the vaccines, and to offer reassurance about the overall safety of the vaccines. Next slide. The first author is Dr. Matthew Oster, and the senior author is Dr. Tom Shimabukuro. Please join me in congratulating the 2023 Charles Shepard Award winner in the assessment category. Now, I would like to welcome Dr. Laura Coleman, Chair for the Data Methods and Study Design Committee.
Thank you, Dr. Ajani. Good afternoon, everyone. The Data Methods and Study Design category recognizes publications across CDC, ATSDR that report on a new or refined non-laboratory method and/or a new innovative or otherwise exceptional study design that addresses one or more public health challenge. In other words, this award recognizes the development and demonstration of an outstanding or exceptional approach to solving a public health problem. Next slide, please. I would like to acknowledge the members of the 2023 Charles C. Shepard Data Methods and Study Design Subcommittee, and thank them for their expertise for serving on this subcommittee. Next slide, please. There were 13 excellent nominations in the data methods and study design category, as shown in the following 3 slides, which made choosing the winner very difficult. And the winner of the 2023 Charles C. Shepard Science Award for Excellence in the Data Methods and Study Design category is, next slide, please. Nearest neighbors matching for case control study analyses, better risk for factor identification from a study of sporadic campylobacteriosis in the United States. The analysis in our paper allowed us to gain greater insight into the underlying sources of the most common bacterial enteric pathogen in the United States, Campylobacter. But more importantly, the paper provides a sound description and demonstration of a novel method that is universally applicable to case control studies of any disease. It has the potential to have a far-reaching effect on our understanding of various diseases and measures to prevent them. Next slide, please. First author Zhao Hui Sui and senior author Bo B. Bryce. Please join me in congratulating the 2023 Charles C. Shepard Award winner in the Data Methods and Study Design category. I'd like to welcome Dr. Donna McCree, Chair of the Health Equity Science subcategory.
Thank you, Dr. Coleman, and good afternoon, everyone. The Health Equity Science category recognizes publications across CDC and ATSDR that contribute to health equity science by identifying effective, new, or emerging approaches to reduce health disparities and advance health equity. Next slide. I acknowledge the members of the 2023 Charles C. Shepard Health Equity Science Subcommittee and thank them for their expertise and their time. Next slide. There were 13 excellent nominations in the Health Equity Science category, as shown in the following 3 slides, which made choosing the winner very difficult. And the winner is of the 2023 Charles C. Shepard Science Award for Excellence in the Health Equity Science category is, next slide, are home evictions associated with child welfare system involvement, empirical evidence from national eviction records and Child Protective Services data. This is the first national study to provide evidence on the racial and ethnic disparities of child welfare system involvement associated with home evictions. No prior study has used large-scale national data and examined this topic from a health equity lens. Further, this study shows evidence that interventions, programs, policies, and strategies that address economic stability, affordable housing, and other upstream social determinants of health may help reduce child abuse and neglect and racial and ethnic inequities. Next slide, please. Lead author, Dr. Shichao Chung, senior author, Robin Gertner. Please join me in congratulating the 2023 Charles Shepard Award winner in the Health Equity Science category. And now I'd like to welcome Dr. Shukat Kare, Chair for the Laboratory Science Subcommittee.
Thank you, Dr. McCree, and good afternoon, everyone. In the laboratory science category, we recognize publications from across CDC, ATSDR that describe the development or use of laboratory methods to solve problems of public health importance. Next slide, please. I would like to acknowledge all the members of the subcommittee and thank them for their expertise and for serving on this subcommittee. Thank you. Next slide, please. There were 11 excellent nominations in the laboratory science category, as shown in the following 3 slides, which made choosing the winner very difficult. And the winner of the 2023 Charles C. Shepard Science Award for Excellence in the Laboratory Science category is, next slide, please. Multiple lineages of monkeypox virus detected in the United States, 2021 to 22, published in the journal Science. About the impact of this publication, CDC scientists and partners performed one of the earliest rigorous genetic studies of monkeypox virus during the 2022 Mpox outbreak and identified unique mutations in the 2022 outbreak variant that did not impact sensitivity to available therapeutics or diagnostic tests, but did show indications of extensive human antiviral editing, suggesting sustained human-to-human transmission of Mpox since 2017. Next slide, please. First author, Crystal M. Gigante, and senior author is Yu Li. So please join me in congratulating the 2023 Charles Shepard Award winners in the laboratory science category. And now I would like to welcome Dr. Matthew Hogben, Chair for the Prevention and Control Subcommittee. Thank you.
Thank you, Dr. Kari, and good afternoon, everyone. The Prevention and Control category recognizes publications across CDC and APSDR that address the prevention and control of diseases, conditions, and other public health challenges, as well as the prevention and control of risk factors at all levels for these diseases, conditions, or challenges. Next slide, please. I would like to acknowledge the members of the 2023 Charles C. Shepard Prevention and Control Subcommittee. Thank you all for your expertise and for the pleasure of your very thoughtful contributions during the term of this subcommittee. There were 18 excellent nominations in the Prevention and Control category. This will be shown in the following 4 slides, and it certainly put our expertise and our thoughtfulness to the test. Next slides, please. And the winner of the 2023 Charles C. Shepard Science Award for Excellence in the Prevention and Control category is, next slide, association between 3 doses of mRNA COVID-19 vaccine and symptomatic infection caused by the SARS-CoV-2, Omicron, and Delta variants. At the height of the Omicron surge, this study leveraged data from a national testing platform to provide critical information on COVID-19 vaccine effectiveness against the Omicron variant. The results were presented by Dr. Walensky in congressional testimony. They supported CDC's efforts to increase booster dose coverage among U.S. adults. Informed the January 5th, 2022 U.S. recommendation for booster doses in adolescents aged 12 to 15 years, and represented the first peer-reviewed U.S. vaccine effectiveness estimates for Omicron. Next slide, please. As you read through the author's statement on this slide, please see first author Emma Corsi, co-first author Amadea Britton, and senior authors Stephanie Schrag and co-senior author Jennifer Varani. Please join me in congratulating the 2023 Charles Shepard Award winner in the Prevention and Control category. I'd now like to welcome Dr. Elise Beltrami, the co-chair of the Shepard Awards full committee.
Thank you, Dr. Hogben, and good afternoon, everyone. The Lifetime Scientific Achievement Award recognizes an individual for a full lifetime of scientific work contributing to public health. It is expected that over the years, awardees will represent different scientific disciplines. The individuals nominated in this category are recognized for their research that has made a significant contribution to public health and impact during their time at CDC. This includes their vision, innovation, and their efforts to address emerging public health challenges. The nominee's impact on public health is reviewed based on the utility, breadth, and impact to enhancing the CDC ATSDR mission. Next slide, please. The nominees for the Lifetime Scientific Achievement Award this year are Dr. Terrence Chorba from the National Center for HIV, Viral Hepatitis, STD, and TB Prevention, Dr. Janet Fulton from the National Center for Chronic Disease Prevention and Health Promotion, Dr. W. Evan Secor from the Global Health Center, Dr. Barbara E. Mann from the National Center for Immunization and Respiratory Diseases, Mr. Andy Sakala from the National Institute for Occupational Safety and Health, and Dr. Cindy A. Moore from the National Center on Birth Defects and Developmental Disabilities. Next slide, please. And the winner of the 2023 Lifetime Scientific Achievement Award is, next slide, please, Mr. Andy Sakala from the National Institute for Occupational Safety and Health. Congratulations, Andy. Andy's CIO provided a brief impact statement, and Andy provided an acceptance statement in advance of the award ceremony, which is shown on this slide. Now I would like to turn it over to Dr. Stephen G. Sawyer Jr., who will make brief remarks about our 2023 Lifetime Scientific Achievement Award winner.
Well, thank you so much, Dr. Beltrami. It is my absolute pleasure to congratulate Andy Sakala for receiving the Charles C. Shepard Award for Lifetime Scientific Achievement, recognizing his influential 43-year federal government career. When I reflect on Andy's career, it's clear to me that not only has he been a stellar researcher, leader, and colleague, but Andy has truly embodied Dr. Cohen's CDC core values. Andy's always understood that we in the NIOSH Pittsburgh Mining Research Division work in service of the nation's mining workforce, and Andy has devoted his entire career to reduce miners' exposure to respirable hazards through dust monitoring and engineering controls. This is evidenced by the multiple interventions that Andy has developed to be employed directly by the miners, including helmet cam technology, closed cleaning booth, and the smart cap technology for enclosed equipment cabs. Evidence-based and visionary applied research have been the hallmark of Andy's career. And citing just one example, during the groundbreaking research on enclosed cab filtration and pressurization systems, Andy has led a team of researchers in several complex tasks in both field and lab studies to determine the dynamic root causes of workers' overexposure when operating mobile mining equipment with an enclosed cab. Andy has also demonstrated the importance and value of collaboration, and is first to acknowledge that research simply cannot happen without a team of collaborators. Andy has collaborated with other government agencies, including MSHA and NASA, and perhaps most importantly, Andy has collaborated with numerous entities within the mining industry that has allowed him to conduct research that has resulted in meaningful solutions that miners have implemented. Throughout his entire career, but especially in the more recent years when he's moved into management positions, Andy exhibited transparency with employees and colleagues. He freely shares his research practices, ideas, and knowledge, and conveys the importance of conducting transparent and rigorous science. When it comes to excellence, Andy is recognized nationally and internationally as an expert in the field of monitoring and controlling the exposure of workers to respirable dust. He's authored 160 publications, including the development of 2 editions of the Dust Control Handbook for Industrial Minerals, Mining, and Processing. While serving as the Health Hazard Prevention Branch Chief, Andy demonstrated a noteworthy level of stewardshipness for the branch in its research by focusing on developing and mentorship. Andy understands that it's the next generation of researchers who will carry the torch in protecting the health and safety of the mining industry. Finally, Joy and belonging are two characteristics that Andy exudes. Just being around him, his passion for the mining industry, and his belief that people he works with are his family is immediately apparent. He fosters joy and belonging with everyone in the division, whether by enthusiastically assisting on research tasks or by facilitating time within branch meetings for non-US born branch members to share information about their countries of origin. It's just Andy's nature to welcome you in, want to learn more about you, and share his joy. And I'd like to once again congratulate Andy Sakala on this incredible award, because I cannot think of anyone more deserving. Now I'd like to throw it back to you, Dr. Petrani.
Thanks, Dr. Sawyer, and congratulations again to Andy Sakala. Now I'd like to introduce Dr. Deborah Howry to provide closing remarks. Deborah Howry, MD, MPH, is the Chief Medical Officer and Deputy Director for Program and Science at CDC. Most recently, she served as CDC's Acting Principal Deputy Director, and prior to that, Dr. Howry served for over 7 years as the Director of the National Center for Injury Prevention and Control. Dr. Howry previously served as an Associate Professor at Emory University, an emergency physician at Grady Memorial Hospital. Dr. Howry received her MD and MPH degrees from Tulane University and completed her residency training in emergency medicine at Denver Health Medical Center. Thanks, Dr. Howry, and over to you.
Well, thank you so much. And good afternoon, and really appreciate everybody joining today's ceremony. It's been great to see how many people have stayed throughout this entire ceremony. And first, want to thank the Office of Science for organizing this event and the committee that made it happen. Huge congratulations to the winners of the 2023 Charles C. Shepard Science Awards. We are so honored to share this celebration of your achievements. CDC is sought upon across the nation for our scientific expertise, and this wouldn't be possible without each of you and your unique expertise. We recognize your contributions to our agency each day, and today we're really celebrating you, the scientists who make our agency what it is. I also want to thank our guest speaker, Dr. Adam Grant. I actually read his book over the weekend for sharing his inspiring work on how we can apply his principles to our work at CDC. And I want to thank him and Dr. Mandy Cohen for today's fireside chat. We all have hidden potential, and the true measure of our potential is not about where we are at our peak, but the journey it takes us to get there. And so I encourage you to take these lessons to heart in your work, seek discomfort, become a human sponge, and embrace imperfection. Building those character skills are what allow us to become the best version of ourselves. And, public health truly is a team sport, and it's up to all of us to bring out the best in each other. To me, this was really struck home in his story about the Raging Rooks, which were a young chess team from Harlem. And they went up against a known competitive team from a private school. The private school had selected everybody based on aptitude early on and trained them. For Raging Rooks, they took people who were just interested, gave them the tools, and the Raging Rooks won. And it was really about not just the underdog, but realizing what were the hidden potential in people and giving them the tools and the systems they needed to succeed and thrive. So to me, that is what we do. So to close, I just want to thank our scientists for their outstanding contributions and your enthusiasm for discovery and interest in shaping the CDC of the future. The science you do each day drives action to protect the nation's health, and we have an agency that's bursting with potential, and these awards are an illustration of that potential being realized. So I'd like to turn it back over to Tandra Bailey Johnson to conclude today's ceremony.
Thank you so much for attending the 2023 Charles C. Shepard ceremony. I would like to conclude this ceremony and have a great rest of your workday.